A 3-year-old child presented with abdominal distension, anemia, easy bruisability and bone pain. Her X-ray of the lower limb and bone marrow biopsy is shown here. Can you make a diagnosis? I'll give 2 clues. So on one side you can see a tissue paper which is a crumpled tissue paper, and on other side what you are seeing is Erlenmeyer flask. Yes, now you know it. It is none other than the Gaucher's disease or Gaucher's disease. Now we will discuss about Gaucher's disease. Gaucher's disease, there are certain characteristic things that you have to learn in Gaucher's disease. One, this is the most common lysosomal storage disorder. So in the Gaucher's disease, we are going to learn first its biochemical defect, then its clinical features. The biochemical defect is glucocerebroside is converted to ceramide by an enzyme which is called as beta glucosidase, otherwise called as glucocerebrosidase. Glucocerebrosidase. So here the defect is in this enzyme, beta glucosidase or glucocerebrosidase. So if this is defective, what is accumulating here? It is very evident that glucocerebroside accumulate. Now, can you correlate with this with something that we have learned in glycolipids? That is, glucocerebroside is present where? It is present in the non-neural tissues. Non-neural tissues, like it is present in the reticuloendothelial system. So, you can correlate with this, that is, non-neural tissues means in the case of this disorder, Gaucher's disease, it is not present in neural tissue, so there is no mental retardation. The most common type, there are subtypes in the Gaucher's disease which has mental retardation, but the most common is the type 1. In the type 1, there is no mental retardation. And next is, actually the current terminology for mental retardation is intellectual disability. So there is no intellectual disability, and you can see it is in non-neural tissues like reticuloendothelial system. So there is organomegaly. Whereas when you compare, so I will just compare Krabbe's versus Gaucher. So Krabbe's, what is accumulating is galactocerebroside. In Gaucher, what is accumulating is increased glucocerebroside. Galactocerebroside is present in neural tissues. So there is severe neurological deficit. But there is no organomegaly or no visceromegaly. No visceromegaly. Whereas Gaucher is present in non-neural tissues. So there is no neurological deficits. But as it is in the non-neural tissues, visceromegaly is present. So this is a comparison of Krabbe's versus Gaucher disease. So now we'll see the other features of Gaucher's disease, that is its clinical features. So the clinical features can be explained by its accumulation. There is increased glucocerebroside, in the reticuloendothelial system. This causes hepatosplenomegaly. And I have told you there is no mental retardation. And there is no cherry red spot. But remember here, in type 2 Gauchers, type 2 Gauchers, which is not a very common entity, it is a very rare entity, cherry red spot is present. So, cherry red spot is present in type 2 Gaucher disease, and some books like in ophthalmology it is given as a pseudo cherry red spot. So, in the type 1, that is the most common Gaucher disease, there is no cherry red spot. Only in a subtype, which is a very rare entity, there is cherry red spot. The other clinical features are you can see that there is accumulation of the glucocerebroside. In the bone marrow. It causes or infiltration into the bone marrow, it causes pancytopenia, which causes decreased thrombocytes, which leads to bleeding manifestation. And the accumulation of the bone marrow, glucocerebrosides in the bone marrow itself is causing the pain and pathological fractures of the long bones. Pathological fractures of long bones. So, these are the clinical features of Gaucher disease, where we have seen there is no mental retardation, there is no cherry red spot, but there is pain and pathological fractures of the long bones with pancytopenia, which causing the bleeding manifestation. Then we have seen hepatosplenomegaly, so there is visceromegaly is present, and we have seen that there is no mental retardation. So, these are the clinical features of Gaucher disease. In the Gaucher disease, some additional points I want to discuss is about its treatment. The current modalities of treatment of Gaucher is the enzyme replacement therapy is available. The enzyme replacement therapy, which is nowadays given as the acid beta glucosidase. The acid beta glucosidase is otherwise called as imiglucerase. So, this is one of the treatments given for the Gaucher disease, and other enzyme replacement therapies, the newly available other enzyme replacement therapies are velaglucerase alpha, then talglucerase alpha. So, talglucerase alpha. So, these are other enzyme replacement therapies available. So, that is the first treatment, enzyme replacement therapy. The second treatment is a substrate reduction therapy. That is miglustat. The action of miglustat is The miglustat inhibit glucosyl ceramide synthase. So, what is accumulating here is a glucocerebroside. So, if glucocerebroside itself is not synthesized, then the symptoms can be relieved. So, that is why miglustat is used. And finally, bone marrow transplantation is also available. Bone marrow transplantation. And one more I should discuss in the Gaucher is its diagnosis. It is very characteristic, like X-ray of the femur. X-ray of the femur shows Erlenmeyer flask deformity, the X-ray then in the bone marrow biopsy, Gaucher cell is present. Gaucher cell is present, and this Gaucher cell which is seen in the bone marrow biopsy is having a crumpled tissue paper, or it is given as wrinkled paper appearance. So, that is the diagnosis of Gaucher disease. So, this is what I have told you. This is the Gaucher cell. Which you can see the crumpled tissue paper appearance, and this is the Erlenmeyer flask deformity. This is the Erlenmeyer flask deformity that you see in the X-ray of the femur.